Well, joining us now is the Federal Minister of Health, Jean-Yves Duclos. Minister Duclos, thank you for being here today.
Thank you, Michael, and hello to everyone.
Now, you've been busy traveling the country, signing the individual health agreements with the provinces, but still, Quebec and the territories have not signed on. What's the holdup there?
Well, we're looking forward to announce the receipt of the letters with acknowledging agreement in principle on the offer that the Prime Minister made a few weeks ago. I think these letters will come quite quickly and we'll then be able to make them public.
Okay, so quite quickly, so we won't be waiting long?
No, because lots of work has been already done. No, in fact, the work extends to the last year and a half, working with all provinces and all territories in preparing for the important announcement that was made by the Prime Minister a few weeks ago, and more importantly, the important work that we now need to do together.
Which, of course, would be huge, because it means then that every jurisdiction in the country, once those agreements are in place, are essentially accepting the $46 billion put forward by your government to deal with the healthcare crisis. But, you know, when you look at that dollar figure, it is still less than what the provinces were hoping for. Are you worried that will give them an excuse, if you will, to not actually meet the challenge of the healthcare crisis right now without the money that they wanted?
Two things on that. First, they were asking for 35% of provincial healthcare expenditures. That indeed has been the norm over the last 40 years when we include tax points. And we're getting back to 35% now with the investment that the federal government is making. Second, these dollars are meaningless if they don't come with results. Now, these dollars come from the same pockets of the same taxpayers, so they need to generate results for those things to be meaningful for patients and workers. And that's why with the dollars now comes the work that provinces will need to do in writing up their action plans. Action plans, for instance, on how many more Canadians will have access to family medicine, how many more Canadians will have access to mental health care, especially for younger Canadians, how many workers will be able to hire and therefore be able to reduce backlogs, and finally, by how fast are we going to modernize our health data system so that workers, nurses, physicians, and lab technicians can better work together and better care for patients.
Mm-hmm. And I take it what you're saying about the 35%, of course, how the federal government interprets that 35% and calculates to it different than what the provinces have been arguing. Are you worried, though, given the gap in that calculation, that without the calculation or basing it on what the provinces were saying, that it opens up to more innovation that might equate to more private healthcare delivery?
Again, two things. The 35% is the 35% that provinces have been using when they point to the past. They said if we include tax points, that's been 35%. We want that being brought back to 35%. And if we add the new dollars, we'll be back to 35%. But again, more importantly, is what those results will be with those incremental federal dollars. And you're right to pointing out that one way to mitigate the trend, the pressures on the healthcare system is to invest in the public healthcare system. There are other ways to deal with emergencies, and we recognize that this is entirely provincial jurisdiction, but supporting the public healthcare delivery of healthcare services is key with this agreement. We've been very clear, very open to with provinces and territories that these dollars are intended to support the public delivery of healthcare services in Canada.
Public healthcare delivery, but is it an acceptance that not every single component of healthcare can be delivered publicly, just these dollars will be dedicated to that?
And that's understandable. The provinces and territories have been using the private delivery of healthcare services for years and decades. You know, physicians or self-employed workers. There are many other healthcare workers who are also self-employed and therefore privately delivering healthcare services for Canadians.
So do you think the language around the debate has to change? Because right now there's still very much this debate in this country, public versus private, and really what we're talking about is a mixed system. Do you think the language around the debate has to change when we talk about the healthcare crisis and how we get out to the other side of it?
The objectives of our collaboration need to be very clear. As a federal health minister, one of my obligations is to make sure that the requirements of the Canada Health Act are respected by all provinces and territories and by the federal government in particular. And one of these key requirements is that people don't pay with their credit card when they need to have access to medically necessary healthcare services. Another requirement is that these services are equitably accessible by all Canadians. But these are requirements understood by all health ministers, and I'm going to continue to make sure that this is the case.
Mm-hmm. Now, the premiers have asked for a review process. Going back to the dollars here, they're worried about falling over the so-called fiscal cliff when their deals expire. How are you going to address that? Will you give them that review?
The answer is yes. There will be a review in 2025, 2026, both a review of the investments, including the investments by the provinces and territories, and then a review of the results which we will have achieved by then. Again, dollars matter. They come from the same pockets, the same taxpayers. What matters even more is what results these dollars are going to bring for workers and patients.
Mm-hmm. As you noted, of course, healthcare delivery in this country is jurisdictionally that of the provinces. But as the federal health minister, certainly there are Canadians right across this country that are struggling with very common concerns. A lack of primary care physician, having to wait in emergency clinics, trying to see a doctor. Preventative health care is thrown out the window if you don't actually have a primary health care provider. What do you say to Canadians right now, as the federal health minister, and the hopes of your government with this investment, what it actually does to improve their lives?
Exactly that, Michael. You said it so well. Access to family health teams, access to primary care, access to family medicine is a cornerstone of a well-functioning healthcare system in Canada. We need every Canadian to have access to a family health team, because if they don't, as you said, they end up waiting, and when they fall sick and very sick, they have to go to an emergency department, and that's not where people should be treated first. So that's why a key element of our agreement with provinces and territories is to increase the number of Canadians who can have access to quick, timely and appropriate community-based family health team services.
And do you expect that need to be met by the 3-year timetable here?
We expect progress to be made quite significantly on that. It's a key priority of all health ministers. All health ministers understand the importance of primary care, family medicine. We're investing significant resources, which I believe are enough to make many more Canadians able to access family health teams, family medicine in this country.
Minister Duclos, really appreciate the time. Thank you for that.
Thank you very much, Michael.